that you're aware. So I mentioned I'd like to cover today the orientation presentation for Accuro EMR. The orientation presentation is actually quite long. You can see that there are quite a few slides. This first slide is one that you probably want to hide. It's just there for your reference to see what slides are, or what subject matter is covered here and which slides they are. You can see there's 72 slides, so quite a lot. And the intent is not that you would sit down and show all 72 slides to a physician or a clinic manager or somebody that you're talking to CI, CPAR about. If you're lucky enough to get that much time, great, but you probably won't. So the idea here is that all of the slides are here for you, and you can pick and choose the ones that are most appropriate to the interactions that you're having. Some of them are great for showing. Some of them will be handy to print out. Some of them are slides that you probably want to keep in your back pocket in case they're handy for questions that come up. But we'll go through them all. So this is often the first slide that we use when we're presenting to a group of physicians, and it's really about the fact that CI and CPAR were actually requested by physicians, and given the current environment, it's easy for physicians to forget that these were actually asked for by physicians and produced for physicians to provide better care for their patients. And really, it just makes the point that the Central Patient Attachment Registry, or CPAR, was requested by the section of family medicine, or section of general practice at the time it was requested, as a way to attach or identify which patients belong to which providers. And an agreement was made between Alberta Health and the physicians to build this tool for primary care. Similarly, community specialists were looking for ways to get their consult reports into Netcare. And the Community Information Integration, or CI, was developed to fulfill that need. The next few slides will talk about why CI, CPAR. It's great technology, but we don't do it just for technology's sake. There has to be a good reason for it. And it really comes down to continuity. And the slides in this section focus on relational continuity, because that's where most of the evidence is. But you can see in this slide, there's also informational continuity and management continuity, which are both nicely, fit nicely into CI, CPAR's wheelhouse. So I generally like to talk about relational continuity when the door to the exam room opens. Does the person who comes through the door know my story, or am I telling them my story for the first time? Informational continuity is really about, is the right information available to the right people at the right time? And management continuity is about care coordination, or does my story follow me when I move through different providers in my circle of care, and are those transitions warm or cold? Our next slide is really a summary of research that's been done on relational continuity, and the research is quite strong to show that relational continuity has great benefits for both patients, providers, and the system. And there's more information on our website. If people are curious to do a review of the literature, there's lots of information there. We talk a lot about how CI CPAR is in alignment with PCN Initiatives, and this slide tries to cover that off. You can see in the patient's medical home, there is actually an implementation element for panel and continuity. And CI CPAR is very much about panel and continuity. Transitions of care, I talked a little bit about transitions of care, but there's a lot of functionality in CI CPAR that can help support transition of care and continuity. And the opioid response maybe is not quite as obvious, but one of the things that CI CPAR can enable are notifications to physician EMRs to let them know when their patients have had a touch point in the healthcare system. And particularly if an at-risk patient is in a hospital and a physician is alerted, they can do some follow-up to make sure that the at-risk patient is looked after. This slide looks at the Relational Continuity Clinical Practice Guideline. You may or may not have the opportunity to talk about this depending on how interested your physicians are, but relational continuity was actually considered so important and its outcomes so valuable that even though continuity is not really a clinical intervention, the value that's associated with it made it worthwhile to create a relational continuity clinical practice guideline. It's available on our website, and it contains recommendations about how to improve relational continuity within a clinic, and definitely worth letting people, your physicians know about. So the next section is, what are CI and CPAR? What are they? What are they about? And this is great information for if you're speaking with a group that hasn't heard too much about CI, CPAR. They'll probably want to know some of these things. So first, what is CII? It's Community Information Integration, and it's a system that allows information to flow from community physician office EMRs through a data hub to Alberta Netcare. And you'll notice that on this slide, information also is shown flowing to the healthcare data repository. This is often seeing this slide is often the first time that physicians notice or learn about the healthcare data repository. And so our next slide covers off what is the healthcare data repository, and more importantly, who is responsible for deciding what happens with this information. Quite often a physician will say, what is this healthcare data repository, and who's doing what with the information? The information is there for secondary use, for quality improvement and health system resources planning. And we have a document on the site of one of the privacy and security documents, the PIA summary document, that outlines the fact that there's governance for the group. It's a group called the Healthcare Information Data Governance Committee with representatives from across the spectrum. And they are responsible for deciding who gets to use the information and how it's used. It's not just available for anybody. Next is the Central Patient Attachment Registry, or CPAR. And CPAR is a system, it's a database that captures confirmed relationships between primary providers and their patients across the province. Information flows automatically there from a physician's EMR. So physicians are essentially saying, this is my panel of patients that I believe I'm responsible for. It's really the next logical step for practices that have invested in panel management work. And it's of course foundational for future enhancements. I talked about e-notifications a little bit. The only way to get an e-notification to the provider is to know who the patient belongs to, and CPAR covers that off. There's a number of slides like this one in the presentation, and you can pick and choose how you'd like to use them, but we try to remind people several times during our presentations that all of this information and more is available on the ACT website. And so there's a number of slides that can help to orient people there. The next section is all about how CI CPAR works. And here's where we kind of dig into the nuts and bolts of things. And you've heard so far in your training that CI CPAR shares three kinds of information. There's encounter information, there's panel information, and consult reports. So we'll go through each of those. I'm going to go through encounter information first. And this slide just gives the big picture. Encounter information from defined fields in the EMR flows through the CI data hub to Alberta Netcare into something called a Community Encounter Digest report. And hopefully you've all seen that before, but we're going to have a look at it again. And again, you'll notice that the healthcare data repository shows up on this slide as well. So if for whatever reason, this is the slide that you're showing to a physician, and this is the first time they see the healthcare data repository, good idea to have that other healthcare data repository slide in your back pocket to show. When the information flows up to Netcare, it flows into the Community Encounter Digest, and that sits in a new menu item in the left-hand side of Netcare called Community Reports. And that's where it can be found. And we know even though there hasn't been a lot of announcement about it in hospitals and other healthcare environments, docs are finding them and they're getting used already. We'll go through the Community Encounter Digest again for you, because we're going to be looking at the digest and where does the information come from in the EMR to form it. So again, the top section is Community Encounters. So this is a list of recent encounters for the patient. It's a 12-month rolling snapshot, so it's not a complete list of the patient's history. And things will come on and then roll off after 12 months. You can see that you've got encounter date, the location, the name of the provider, and the provider's role, the patient reason for the encounter, the reason that they gave to reception when they they made the appointment, and the clinician's assessment of the patient, including hopefully diagnostic code. There's also a section for health concern. If a new problem is entered into the problem list in the EMR, that'll show up here in the health concern history. And again, date, the health concern, the provider's name, and where it came from. The system will recognize allergies. It only recognizes them as possible allergies. It's not smart enough to know if an allergy has been confirmed or not. But if an allergy is entered in the problem list, or the allergy list, excuse me, it'll show up here in the Community Encounter Digest. There's a section for called measured observations, which is really vital. So blood pressure, height, weight, and waist circumference, if they're entered in the encounter, will show up here. And again, the date and the source. If a referral is made in the EMR, the type of referral and the date will show up here, as well as if the clinic subsequently enters an appointment date at the specialist's office, it can show here in the referral occurrence date as well. And finally, there's a section for immunizations. Unfortunately, our picture doesn't have a shot of what the immunizations look like, but I'll show you where that data comes from in a moment here. This slide has a list of all of the data elements that are pulled from an EMR for CII CPAR and gives a rough idea about where they're going. So anything that's green is going to Netcare and the healthcare data repository. Elements that are in white are going to the healthcare data repository, but not to Netcare. And you can see that most of them are metadata, their dates and times and things, or their data that is already in Netcare from another source, things like labs and diagnostic imaging. And then on the right, there's the data that is sourced for CPAR, and we're going to go over all of that in the places in the EMR where it comes from. So one of the most important things about the orientation presentation is it has this section on data mapping, and it's really important that everyone who's using the EMR, but particularly physicians, have an idea where the information is being pulled out of the EMR, so which fields are going to go to Netcare and which fields are not. And I find that we're going to show screenshots, and when you show these screenshots to physicians, they generally are much more relaxed about what it's going to look like. There's not a lot of data, and it's fairly basic. So a couple of things that have to be set up in the EMR first. There's a few things that need to be done. I'll leave it for you to have a look at the user guide and see what needs to be set up in Accuro. It's not something that you need to know until a clinic's actually going through the onboarding process, and it's quite straightforward. You have to map a few things and configure your EMR for consult report sharing. And it's important to know what are the criteria for chart items to go. So there's certain criteria that have to be met in all of the EMRs before information can actually flow. And it's basic stuff that's normally in place, but it's important to know that those things are not in place, then information won't flow. So in Accuro, information has to be associated with a valid appointment. There needs to be a recorded owner, and there has to be a date of service that's after the start date that the provider started using CII CPAR. Nothing that happens before the start date is shared to Netcare. If there's information that has no recorded owner, as long as it's associated on the schedule with a provider who has opted to participate, that information can go. Patient must be active. And one of the most important things, because Accuro doesn't have an official close the appointment type function, anything that's added within 48 hours of the appointment is assumed to be part of that appointment and will flow to Netcare as part of the appointment. What that also means is that appointments don't show up in Netcare for 48 hours plus overnight until that time period has elapsed. All right, so we're gonna, next number of slides, we're gonna actually dig into the EMR and have a look at which fields are mapped and flow to Netcare. And I'll point out that there's a legend on this slide. So things that flow to Netcare are highlighted in blue. Things that flow to the healthcare data repository are highlighted in yellow, and things that flow to CPAR are highlighted in orange. And as we go through, you'll see that there's some information that goes to both places. But you can see facility number and name are pulled out of the facility data in the EMR. And the name is also sent to Netcare to identify where the appointment happened. And the facility postal code also is sent to the healthcare data repository. The reason for the appointment comes from the reason field in the scheduler. And interestingly, in Accuro, this is not a free text field. It is in some of the other EMRs. In Accuro, it's a drop-down. And so the list will be what the clinic has set up. And many clinics will have a number of reasons, and then they'll also have other for an appointment that's not in their list. What that means is if other is selected, that's what will show in Netcare. And that's fine, but when physicians see that, that'll be an alert maybe that they might want to add a few more reasons to the reason list. They'll just have to decide how they feel about how it looks. Appointment date and time are pulled from the appointment, and claim codes are pulled from the bill and flow to the healthcare data repository. Patient information is pulled from the demographic area, so obviously first name, last name, date of birth. What is the patient status, active or not? And that's key for CPAR, which we'll see in a little bit. And also the patient's postal code goes to the healthcare data repository. For providers, again, information from the provider area in the EMR, first name, last name. The provider's PRAC ID flows to the healthcare data repository, but not to Netcare. The provider's specialty from the provider type and specialty also flow to the CED. Information for CPAR comes from patient demographics to identify the patient, their birth date, EULI, gender, etc. And also to the healthcare data repository, their status and postal codes are shared. Important for CPAR are a couple of things. The confirmed dates, so the last time the patient's demographics and primary provider were confirmed in the EMR are recorded and shared to CPAR. We'll see that in the conflict report in a little bit. And also the patient must have a last visit date. So if a patient has never had a visit, the system assumes that they cannot be part of a CPAR panel. Information about vitals comes from the lab section of Accuro, and you can see blood pressure, height, weight, and waist circumference. Allergy information comes from the allergies section, and it's just the allergy, it's not, or the allergen, it's not, other information about the allergy entry is not taken, and that's why on the CED, it just shows as a possible allergy. Clinical assessment also comes from the claims section of the EMR, and we'll pull the diagnostic or the diagnostic code and the text that accompanies the diagnostic code. And if a new entry is entered in the problem list or the medical history band, it will record the date and what the problem was recorded in this example, diabetes. There's a couple of sections of the EMR where information is pulled to the data repository, but does not go to Netcare. Surgical entries, if a patient has had a surgical entry, it'll pull to the healthcare data repository, but not show in Netcare because that information should be in Netcare from another source. If a lab rec is done, the fact that a lab rec was done and the date will flow to the healthcare data repository, though it does not actually record which labs were ordered. Same with diagnostic imaging. If diagnostic imaging is requested, it'll record the fact that diagnostic imaging was requested and the date that it happened, and that goes to the healthcare data repository, but not to Netcare. If there's a vaccination, it'll pull the vaccine name and the lot number and the date that the vaccine was administered and share that information into the CED. And you can see on the right-hand side here where referral information comes from for if a referral is done during the encounter. This slide hopefully can give physicians the ability to see how all of those things that we just went through relate to the places on the CED where information shows up. So if we start on the top and go in counterclockwise, or excuse me, go in a clockwise direction, you can see where the name of the facility is coming from, the first name, last name of the provider, the reason for encounter from the scheduler, the diagnostic code from the claims section, information about new health concerns, and immunizations in their appropriate spots, information about new consult requests, the vitals and allergies, and finally the provider demographics. All that information is available in the mapping document and user guides that I showed on the website. And these are really handy documents to have with you when you're talking to physicians, particularly the mapping. As I mentioned before, if physicians can see the mapping, they're generally much more relaxed about what information is shared and how it's shared, because they can see where it comes from in their EMR, and they can see that it's fairly basic information. That's quite a lot of information. So if you feel like you have questions or you're concerned or something didn't make sense, please feel free to put a question into the chat and we'll address it. Very good. Don't hesitate if a question comes. Don't hesitate to put it into the chat, and we'll be happy to answer. So I want to talk a little bit about confidentiality in the EMR, and we have a couple of slides, or we have this slide that addresses that. So there are a couple of ways to keep information private in Accuro. First, you can choose to, whoops, sorry guys. You can choose to make an entire chart confidential in the patient's demographic section. And you can see there's a new checkbox at the bottom of the section that says, do not share EMR or consult data with CI CPAR. Essentially, that just says, do not share any information through CI CPAR to Netcare. And an appointment can also be made if you don't want to make the whole chart confidential, but would like to make an appointment confidential. That can be done from the appointment or from the scheduler. In the right-click drop-down, there's an option to do not share data, do not share EMR or consult data with CI CPAR. But one of the things to bear in mind and to advise physicians is that the easiest way to keep things confidential is to chart them in a place that is not shared. And that's pretty easy to do in Accuro because all of the fields are discrete data fields. There aren't any free text fields. So if you're charting in a free text field, you're safe. And if you're charting in a field that you know does not map to Netcare, then that information will not be shared. Next type of, so that's encounter information. Now I'd like to talk a little bit about consult reports going to Netcare. And encounter information can be complicated. Consult reports are nice and easy. So consults are created into PDFs, and those PDFs are generally used to share to fax or send to the referring physician. They can also be sent to Netcare as a PDF, and the same PDF that goes to the requesting physician goes up to Netcare and is stored there as a consult. There's a couple of ways to keep consult reports from flowing to Netcare. The easiest one is that for any consult report to go to Netcare, it must have the type consult report in the letter creation section of the EMR. So as long as this is something else, the information does not flow to Netcare, but anything that is the type consult report will flow to Netcare as a PDF and be part of the consult record for the patient. There's another option as well in Accuro. If If the physician is creating a consult letter that's not actually associated with an appointment, then the system would choose to share it unless the doc chooses otherwise. And you can see that in that instance, a warning will pop up that says the selected date of service does not correspond to an existing appointment, and giving a number of fields and the option at the bottom to not share with CI, CPAR. And you can check that box to keep the consult report from flowing to Netcare. Consult reports in Netcare go into the consultations folder in the menu on the left, and they can be found there. The final sort of information that flows is panel lists, and we'll go through panel lists for CPAR, and you can see, again, flowing through the CI Data Hub and into the Central Patient Attachment Registry rather than Netcare, where panels are used to create a demographic mismatch report or a panel conflict report, and we'll talk about those two things in a second. And you'll notice that the healthcare data repository is here as well. Again, the information about panels does flow to the healthcare data repository. Looking at the mapping for CPAR, we saw this a little bit already, but you can see we've got name, date of birth, gender, the patient's PHN. Very important that the attached provider's name is in the office provider field. That's where the EMR recognizes that this physician is attached to this patient. The date last verified, and a couple of other things that are important. I mentioned the last visit date, that pulls from the scheduler, and there must be a panel number in the provider's record. Those panel numbers are provided as you sign up for CI, CPAR, and they can be entered in the EMR. I mentioned a little while ago that patient statuses in the EMR can be set up to recognize whether they're CI, CPAR friendly or not. And there's a new box a new column in the status box to allow you to do that. So you'll notice in the smaller box there that there's a new column called Active on Panel. That's where you can go to check whether or not the status is appropriate for CI, CPAR. It's important that clinics are aware of the panel submission rules. Again, most of these are pretty straightforward, but important that everyone's up to speed. So in this slide, we've got those rules. In order for things to be automatically submitted, the provider has to have that panel number that we talked about, and the PRAC ID has to be in there. I mentioned that the physician needs to be in the office provider field. The status must be set to one that is active on CI, CPAR, and of course the patient has to have a last visit date. And it's a good suggestion for clinics to look at their panel lists before they actually are sent. Accuro will send panels automatically on the 12th of each month. So it's a good idea to go in and just have a quick look at the panels and make sure that they look the way that you expect. And Accuro has built a new search function to be able to do this. So you can navigate from the Accuro start menu, and there's an option to submit CI, CPAR panels. When you choose that, it'll give you panel numbers, and you can choose those and have a look at the panels that the EMR is identifying for that particular physician, and make sure that all of the information is there and the panel looks right. Here's a graphic representation of how information flows over time into CPAR. And I mentioned that QHR will upload those panels automatically on the 12th of the month. As they're uploaded, anything that errors out in CPAR will create an error report, which can be downloaded the next day. And any errors that are found can be managed over the next few days until the 21st of the month. On the 22nd of the month, CPAR goes into a blackout period. And during that period of the 22nd to the end of the month, it's taking all of the panels that it's received from around the province and comparing them and finding the conflicts and building the conflict reports. And on the 2nd of the month, those conflicts reports will be available again to download from the CPAR website, and then they can be used. And here's what they look like. there's a lot of information on the consult report, and all of that information almost all of that information that flows to CPAR ends up on here. So you can see that there's something called the conflict category, and this indicates whether or not the conflict has happened in the last 30 days or outside of the last 30 days. There's a date when the conflict was first reported, the patient's demographic information. There's the last confirmation date and the last visit date at your clinic. And then there's the conflicting provider and their clinic, and the last confirmation date and last visit date at that clinic. And so you can see that the last confirmation dates become quite important here, because it's going to show when was the last time the patient was asked the question, do you consider Dr. Smith to be your primary provider? And if those dates aren't up to date, then it might be giving bad information to one clinic or the other about who might this patient actually consider to be their primary provider. The other report that's available is the demographic mismatch report. And on the demographic mismatch reports, two things happen. One is that deceased patients are identified. So if a patient is deceased in the patient-client registry and the clinic doesn't know about it yet, this is a good way to find out and hopefully help prevent some of those embarrassing phone calls that you make when you aren't aware that a patient is deceased. And the other part of the report identifies demographic mismatches, where you can see whether there are differences between the EMR and the patient-client registry. And if the information is incorrect in the EMR, then it can be updated. And if it's incorrect in the patient-client registry, then it's a little more complicated because patients have to request that change, but you can let the patient know that the information is not correct. This slide shows future state of things that are coming for CI CPAR in Accuro. And two things I want to point out are e-notifications and patient summary reports. So if you see bottom left, you can see e-notifications. I've talked about those e-notifications. Eventually, hopefully by the end of the year, those will be electronic notices into the EMR about events at Alberta Health Services, and I'll talk more about that in a second. The other piece that's coming probably now into 2021 is patient summary reports. And this is a report that a physician can curate and create in their EMR and upload to Netcare as a PDF, and in it would be information about things that other healthcare providers should know about the patient. So a physician probably wouldn't do a patient summary report for every patient, but for those patients that keep them up at night or have unusual conditions or multiple conditions or off-book medications, anything like that could be included in a patient summary report to let other physicians know what is special about this particular patient. And you'll notice that those patient summary reports are also intended to go to My Health Records. And like I said, hopefully in 2021, we'll be able to see those. A quick note about e-notifications. So we're hoping e-notifications will be ready for Accuro by the end of this year. We don't have any screenshots of those yet, but I can show you what kind of information goes. So if a patient is discharged from the emergency department, if they're admitted or discharged to hospital or they have a day surgery, a physician will get an e-notification in their EMR. They appear similar to lab reports in the EMR. They come in the same way, and they're delivered twice a day the same way labs are, 6 a.m. and 2 p.m. And information in them is fairly basic. It doesn't have detailed information about the patient's visit, but it will say who is the patient, where did the event happen, the date and time, who was the attending provider, and the admission reason. And it will also show if there's more than one provider in CPAR that has this patient on their panel, all providers will be notified. This is a great slide to maybe print out and just have handy with you. There's obviously a lot on it and you can't go through it all when presenting it to a group, but there are a lot of benefits to CI CPAR, and it's not always immediately obvious, especially if you're just learning about CI CPAR for the first time. So having this on hand to give out and for people to peruse, that would be very handy. And I'm happy to say that as the project's gone through its initial stages, we've started to see all of the benefits that you can see there under patient and provider. We've seen examples of all of the things listed here, and it's really exciting. The things listed under PCN and health system, those are more long-term effects, but every expectation that we'll see those as well as CI, CPAR becomes more widely adopted. The next section is about being ready to participate. And this is probably handy if you're talking to a group of people who are just learning about CI, CPAR for the first time and don't know too much about it. There are 4 criteria for participating in CI, CPAR that need to be in place. So the first one is that a clinic needs to be live on Netcare. 2, their PIA must be up to date. 3, they have to be panel ready for clinics that are going to be submitting panels to CPAR. And 4, they have to be on one of the approved EMRs, and that's HealthQuest, Accuro, MedAccess, PS Suite, and Wolf. So this slide just sums those 4 things up, and then we have a number of slides that go through them in more detail. First of all, being live on Alberta Netcare. If a clinic's not live on Alberta Netcare yet, I would strongly encourage them to contact eHealth Support Services through the Netcare website and get the process started. The clinic's PIA must be up to date, and here's where a lot of clinics are feeling nervous about CI, CPAR, and the process of getting on board. A lot of clinics are not up to date on their PIA, and they're not exactly sure how to go about it. So we've tried to create some resources for them, and there's a fair amount of resources out there, and we're working on creating some more. The first one is to let them know about the PIA Update Self-Assessment, which is on our website. A very handy way to just sort of go through a nice, easy questionnaire that gets you thinking about all of the aspects that need to be in place for your PIA, especially if you're not familiar with the PIA process. And it asks simple questions, has there been a change in this or that in your EMR in the next little while? We'll look at that more in a second. There's also guides on the OIPC website, and our colleagues at Alberta Health have created a number of recordings, privacy seminar recordings that are available on the Alberta Health website. And that information is all available in this slide. So one of the things that causes anxiety is, do I need a major update or a minor update to my privacy impact assessment? And it depends on each situation. But here are some common examples of things that might trigger major or minor updates. And again, this slide encourages people to go through the PIA Update Self-Assessment and get that work done so that they can then approach eHealth with a more informed perspective. We have a number of tools for docs and clinics who have questions about privacy. There's an FAQ on the website, summary of key privacy info, and then there's something called the CII PIA summary that goes through all of the privacy impact assessment stuff for the project itself. And the nice thing is that while clinics need to have an up-to-date PIA, they don't have to do a new PIA that mentions CI, CPAR. That work's been done for everybody by Alberta Health. And so what clinics need to do is to sign a letter that says they reviewed that information and they accept it and agree with it. This is a nice slide to use because it sums up kind of all of those things we just looked at in one fell swoop. There's information about the health collection notice poster, the patient brochures, etc. The health collection notice poster, so the requirement for CI, CPAR, and Netcare in general is that clinics don't necessarily have to have a direct connection with their patient, but they do have to inform them that they are participating in this information sharing for the purposes of healthcare. And generally that's done with a poster. Most clinics have a poster in conspicuous locations in their clinic. There's a little bit, the wording of the poster should be slightly different if you're participating in CI, CPAR, and on our website is a mock-up available of that clinics can just print off and use or incorporate that wording into the posters that they have. There's also patient tools available. So there's some scripts for custodians and teams on how to talk to patients about this. There's a patient brochure and a patient FAQ that answer basic questions about information sharing. and the benefits of information sharing, and a little bit about how these things work. The third thing on the list of prerequisites was panel readiness, and we have a checklist for that. If clinics can go through the panel readiness checklist, again, available on our website, if they can go through and check off all the boxes, then they're in great shape to move ahead with CII CPAR. And if they need some help, there's references to a whole bunch of supportive tools on our website that can help them with their panel processes. A lot of physicians want to know, what do I have to do? What are the things that I've got to do, and what are the things that my team can do for me? So we put together a list of the basic things that physicians need to be involved in as they go through CII CPAR. So before go live, physicians need to see the mapping that we went through a little while ago. They need to know about which fields are mapped in their EMR and what information is going to flow. Obviously, they have to make the decision, yes, they want to go ahead. And once they've done that, there's forms that they're going to need to sign because they have to have their signatures on them. Some things that are optional for the physicians that they might want to be involved in, but don't necessarily have to be, is in identifying who in the clinic is going to do the CII CPAR work, particularly who's going to be the site liaison, who is the person that'll lead the clinic through the process of onboarding. They may want to be involved in the privacy process if the PIA needs updating, and that might be with the clinic manager or privacy officer. And they may want to meet with you, PCN facilitators, to talk about the process and what the steps are to move through. And then after go live, physicians need to look at their panel conflict reports and give feedback to the staff. And they'll probably need to be involved in the creation of a process for dealing with the information that comes in the panel conflict report, or at least giving their staff direction on how to manage conflicts that show up. And of course, they're going to receive e-notifications when their patients are in hospital or ER, and so they need to be involved in the process around what happens with those when they come in. Optional activities, somebody should look into Netcare from time to time and see what the community encounter digests look like and make sure that the information is actually displaying in a way that would be expected, and the provider can do that themselves. Or they can delegate that, but they probably will want to, especially for the first little while, want to have a look at those things themselves to see how they look. There's an evaluation for clinics as they go through, so a physician may wish to complete the evaluation and make make comments on how things have gone. And of course, hopefully from all of this, practice facilitators will be working with clinics to do quality improvement around this new information that's coming, and physicians may want to participate in that as well. We have a section now on what happens once you've decided, yes, we want to go ahead and participate. And so there's a couple of slides here that are good for printing out because there's a lot of information on them, and clinic members will probably want to peruse them. This first one shows the steps through the onboarding process once the clinic has said, yes, we want to participate, and filled and completed something called the confirmation of participation form. So there's 4 steps for clinics that are going to be submitting panels, and each of those steps, there are forms and processes involved. For clinics that are not sharing panels, but just encounters and or consult reports, it's a little bit simpler. There's a sort of more of a 2-step process, but again, there's still forms to be filled out. And I mentioned that the first form is the confirmation of participation form. It's a pretty easy form to fill out, but there's a couple of things that people sometimes stumble over. The front of the form is basically clinic and provider information. There are fields for facility ID and WDFA. People don't often always know what those are, but you'll learn what those are as you go through the training. That information can be in there. And then there's questions about what's the PIA look like? Are you panel ready? Even if the answer to those things is that the PIA is not ready yet, that doesn't mean that they can't go ahead. In fact, if they have PIA work to do, it's handy to submit the confirmation of participation form, because that gives a clinic the ability to then access some help from eHealth support services. On the second page of the form, there's boxes where the site liaison can indicate that, yes, we're ready to go. So there's a question about clinic governance structure, and then there are 2 questions where the site liaison initials. One is that providers are aware and they're agreeing that they want to go ahead. And the second one is that training has been presented, and that training is the presentation really of this presentation that I'm going through. So does everyone understand what it is and how it works? And have they seen the mapping? Those are kind of the key things that everyone needs to understand. So a few tips and tools and supports for pre-go live. You probably have all seen the team toolkit, but as you work with site liaisons in your clinics, it'll be new to them. The team toolkit is, of course, the Bible of CI, CPAR. All of the information that you need to go ahead is in there, but for those of you who've seen it, it's a lengthy document. There's a lot of information in there. So helpful to have somebody to introduce it to you rather than just downloading this big document without any kind of context. Another really valuable tool is the clinic journey checklist. So this is all of the steps from initial contact right through to all signed up and all technology actuated. Every step in the process is here on the list. And so you can go through this with your site liaisons and just track your progress and know all of the time what is the next step in your journey. Again, a slide to encourage people to go to the website. We generally end on a slide like this in all of our presentations. There's a ton of information. You saw that the list is long. There's a lot of information there that is useful for everybody. And many of the questions that come up can be answered on our website. So that's the orientation presentation for Accuro, and hopefully you have some questions or thoughts. I'd be happy to hear them. Please feel free to pop them into the chat, and Barb and I will answer them if we can.